911, what's your emergency?
I think my girlfriend overdosed.
Is she breathing? What's your address? Hello?
No, she's not breathing.
What's your name and your address?
America's public enemy number one in the United States is drug abuse. In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive. I have asked the Congress to provide the legislative authority and the funds to fuel this kind of an offensive.
The opioid crisis, prescription pills, heroin, fentanyl. These words are now common in everyday conversations, but behind them lies a devastating epidemic that has affected millions of lives across America. Addiction isn't a simple issue. It's a complex web of social, psychological, economic, and medical factors. In this documentary, we will explore how addiction took hold in America, the systemic forces that fueled it, and the devastating consequences for individuals and communities. America's struggle with addiction has deep roots. As early as the 19th century, addiction was recognized as a social and medical issue. In the mid-1800s, morphine was widely prescribed to soldiers after the Civil War, giving rise to what was then known as soldier's disease, an early form of opioid addiction. It wasn't until the early 1900s that laws like the Harrison Narcotics Tax Act of 1914 began regulating addictive substances like opium and cocaine. Yet even with these early efforts, addiction remained a persistent issue. Fast forward to the 1990s, and a perfect storm was brewing. Pharmaceutical companies, eager to address the growing demand for pain relief, began pushing opioid painkillers into the market. In 1996, Purdue Pharma introduced OxyContin, a drug that promised long-lasting relief without the high risk of addiction. This claim turned out to be dangerously false, and soon, the prescription opioid epidemic was born. By the early 2000s, opioids had become the most prescribed class of drugs in the country. By 2017, approximately 191 million opioid prescriptions were written in the U.S. The Centers for Disease Control and Prevention, CDC, reports that nearly 450,000 Americans died from opioid overdoses between 1999 and 2018. The widespread availability of opioids sparked a chain reaction, where addiction rates skyrocketed and the black market for heroin and fentanyl exploded. In fact, heroin deaths increased dramatically as prescription painkillers became harder to obtain. Heroin, a cheaper and more accessible alternative, quickly gained popularity. And then came fentanyl, synthetic opioids that are 50 to 100 times more potent than morphine. Fentanyl-laced heroin and counterfeit pills have caused thousands of deaths, pushing the crisis to its current alarming level. Today, addiction is not confined to any one social group. It affects people from all walks of life, young and old, rich and poor, urban and rural. According to the National Institute on Drug Abuse, NIDA, in 2020 alone, nearly 21 million Americans aged 12 or older struggled with a substance use disorder. That's nearly 1 in every 10 people in the US. But the problem doesn't just stop at the individual level. Addiction also has widespread societal effects. Families are torn apart, children grow up in unstable environments, and communities are left grappling with increased crime, unemployment, and health disparities. The economic cost of addiction is staggering, with estimates suggesting that substance abuse costs the U.S. economy more than $700 billion annually in lost productivity, healthcare expenses, and criminal justice costs. While addiction affects millions, it's important to acknowledge how the pharmaceutical industry played a central role in creating and perpetuating the crisis. For decades, pharmaceutical companies downplayed the addictive potential of opioids. Purdue Pharma, the maker of OxyContin, faced numerous lawsuits for misleading the public and medical professionals about the risks of their drug. In 2007, Purdue Pharma pleaded guilty to federal charges of misleading the public about OxyContin's addictive properties. But it wasn't until 2020, when Purdue filed for bankruptcy and reached a multi-billion-dollar settlement, that the full extent of their culpability became apparent.
When Purdue Pharma, the maker of OxyContin, declared bankruptcy in 2019, it had no debt and was worth more than $1 billion. How is this possible? Well, Purdue was facing trillions in claims over its role in the opioid crisis.
But Purdue is not alone. Other companies like Johnson & Johnson and McKesson Corporation have faced similar lawsuits for their role in the opioid crisis. In response to this mounting pressure, the pharmaceutical industry has been forced to implement stricter regulations, but the damage has already been done. Trust in the industry has been shattered, and the opioid epidemic continues to ravage communities across the country. Addiction doesn't just take a toll on the individual. Its ripple effect extends to families, communities, and society at large. The consequences are devastating and far-reaching. Families are torn apart as loved ones battle addiction, and the strain on healthcare systems and emergency responders is enormous. Overdose deaths are at an all-time high, and many of those who survive face a lifetime of physical and mental health challenges. For every overdose, there are countless others who struggle with the emotional and financial consequences of addiction. Homelessness, unemployment, and broken relationships are common outcomes for those who find themselves ensnared by addiction. It's a vicious cycle that's hard to break, and for many, recovery feels out of reach. Another critical aspect of the addiction crisis is the connection between mental health and substance abuse. Research has shown that people with mental health disorders are at a higher risk of developing substance use disorders. Conditions like depression, anxiety, PTSD, and bipolar disorder often co-occur with addiction, creating a dangerous cycle that's difficult to escape. The stigma surrounding both mental illness and addiction often prevents individuals from seeking help. Many suffer in silence, afraid of being judged or misunderstood. Without proper treatment and support, those struggling with addiction and mental health disorders may continue down a destructive path. As we look around America today, it's impossible to ignore the continuing toll of addiction. In 2020, overdose deaths reached an all-time high of over 93,000, with opioids accounting for nearly 70% of those deaths. But this crisis is not just limited to opioids. It includes a wide range of substances, from alcohol to methamphetamines, and more recently, synthetic drugs like fentanyl. The rise of fentanyl-laced substances has led to a wave of overdoses, pushing addiction into the forefront of public health concerns. Addiction has become so widespread that it affects nearly every community, no matter how affluent or rural. The Centers for Disease Control and Prevention, CDC, estimates that over 20 million people in the U.S. suffer from some form of substance use disorder. But despite its prevalence, the stigma surrounding addiction remains powerful, preventing many individuals from seeking help and exacerbating the problem. The government's response to the addiction crisis has been both reactive and proactive. On one hand, it has implemented policies to reduce the supply of illicit drugs, including stricter regulations on prescription opioids, international drug enforcement efforts, and increased border security to prevent the trafficking of drugs like fentanyl. However, these measures, while important, have often been criticized for focusing too much on criminalizing addiction rather than addressing the root causes. In 2017, President Donald Trump declared the opioid epidemic a national emergency.
We can be the generation that ends the opioid epidemic. We can do it.
A move that led to additional funding for addiction treatment programs and research. The following year, the U.S. Congress passed the Support for Patients and Communities Act, a sweeping bill designed to address the opioid crisis. This legislation includes provisions for increasing access to medication-assisted treatment, MAT, expanding naloxone distribution, a life-saving medication that reverses opioid overdoses, and improving education about the dangers of opioids. While these efforts have been helpful, they have not been enough to turn the tide. In fact, the COVID-19 pandemic exacerbated the crisis, with many people in recovery relapsing due to isolation, stress, and limited access to treatment. The CDC reported a significant increase in overdose deaths during the pandemic, highlighting the gaps in the healthcare system's ability to provide consistent care to those in need. Healthcare providers play a crucial role in the fight against addiction, but they face several challenges in treating those struggling with substance use disorders. One of the primary barriers is the lack of access to affordable treatment options. Many addiction treatment centers operate on a fee-for-service model, which can be prohibitively expensive for those without insurance or adequate coverage. Even when treatment is accessible, long waiting lists and limited capacity at facilities mean that those who need help may not be able to receive it in a timely manner. Furthermore, there is a shortage of healthcare professionals trained to treat addiction. Although addiction is a medical condition, it is still often treated as a moral failing by some within the healthcare system. This stigma affects both patients and providers, making it harder for individuals to seek help without fear of judgment. For those who do seek treatment, navigating the complexities of insurance and finding a facility that offers comprehensive, evidence-based care can be overwhelming. But there have been advancements in addiction treatment. Medication-assisted treatment, MAT, has proven to be effective in helping people with opioid use disorders by combining medications like methadone or buprenorphine with counseling and support. MAT has been shown to reduce cravings and prevent withdrawal symptoms, helping individuals stay in recovery longer and reducing the risk of overdose. However, access to MAT is still limited in many parts of the country, especially in rural areas. While government and healthcare systems are taking action, communities across America have also been stepping up to address the addiction crisis. Grassroots organizations, local support groups, and recovery networks are making a difference in the lives of those struggling with addiction. Programs like Narcotics Anonymous, NA, and Alcoholics Anonymous, AA, have been crucial in providing ongoing support for individuals in recovery, offering a sense of community and accountability. In some areas, harm reduction programs have been implemented to reduce the risk of overdose and provide support to people who are still using drugs. These programs distribute naloxone, provide clean needles to prevent the spread of infectious diseases, and offer safe spaces where individuals can access support without fear of arrest or judgment. Another promising approach is the rise of recovery schools, institutions that provide a supportive, drug-free environment for young people in recovery. These schools offer education alongside addiction treatment and therapy, helping students rebuild their lives while receiving the support they need to stay sober. Programs like these show how a combination of education, therapy, and community can help break the cycle of addiction. Perhaps one of the biggest challenges in addressing the addiction crisis is overcoming the stigma that surrounds addiction. Many still view addiction as a moral failing, a lack of willpower, or a personal choice. This belief not only deters people from seeking treatment, but also leads to discrimination in the workplace, healthcare settings, and even in their own families. Shifting the public perception of addiction from a moral issue to a medical one is crucial in reducing stigma. Education campaigns, advocacy efforts, and personal stories from individuals in recovery can help change the narrative. By highlighting addiction as a disease that requires medical intervention and long-term support, society can begin to treat those affected by it with the compassion and understanding they deserve. While the addiction crisis in America is far from over, there are reasons for hope. In recent years, the conversation surrounding addiction has evolved, with a growing recognition of the need for compassionate, evidence-based solutions. The fight against addiction is no longer just about fighting drug use. It's about healing the people and communities affected by it. Solutions are already in place, and many are proving to be effective. Expanding access to medication-assisted treatment, improving mental health care, reducing stigma, and investing in prevention programs will be key to combating addiction long-term. By focusing on a combination of public health, education, and community support, America can begin to address the root causes of addiction, rather than just its symptoms. The road to recovery is long, but with continued effort, collaboration, and compassion, there is hope that we can turn the tide on America's addiction crisis. And that's a wrap on today's deep dive into America's addiction crisis. The journey to healing is complex, but awareness and understanding are the first steps. If you found this video informative, don't forget to like, subscribe, and hit the bell icon so you never miss out on more eye-opening facts from Top Facts. If you think this video could help someone, share it with your friends and family. Let's continue the conversation and spread the word about these important issues. Have any thoughts or personal stories? Drop a comment below. I'd love to hear your thoughts. Until next time, stay informed, stay compassionate, and keep exploring the facts that matter.